Major connectors. A list of objectives is presented to assist you in your study. Please refer to the RPD student manuals for supplemental reading. The purpose of the major connector is to unite components across the arch. The minor connector joins the major connector with other units of the partial denture framework. Design of major connectors must be determined during diagnostic and treatment planning phases, because mouth preparation procedures depend, in part, on the contemplated design of major connectors. The major connector must be rigid. This property permits all other component parts of the partial denture to be effective. Major connectors must avoid impingement of movable and gingival tissues. Sufficient relief must be provided beneath major connectors, to avoid any settling into hard areas, such as an inoperable torus, other exostoses, or prominent median palatal suture areas. Relief of free gingival margins must be provided for any component of the framework. Anatomic replica patterns for palatal major connectors permit reproduction of palatal contours. Operable tori or other bony exostoses should be removed to avoid compromises in the design and optimum location of major connectors. Alloys should be biocompatible and strong.
The slide illustrates some selection criteria for the RPD based on whether it is maxillary or mandibular. It is desirable to minimize tissue coverage, but, in general, as support for the partial denture diminishes, the major connector will be more extensive. Most maxillary major connectors possess common design features, as do mandibular major connectors. Become familiar with these features shown in the diagram. Generally, maxillary major connectors cross the midline at right angles, when possible. These major connectors terminate at or anterior to the vibrating line. The major connector should remain 6 mm from the free gingival margin, or else the lingual surface of the tooth should be covered by the framework with relief for gingival tissues. Beading of the cast ensures intimate contact of the major connector with the underlying soft tissue. The simplest mandibular major connector is the lingual bar. Certain situations require the use of other types of connectors, with the lingual plate being the most common.
We will discuss the more common types of major connectors. The lingual bar should be used for mandibular removable partial dentures, where sufficient space exists to place a rigid bar between the slightly elevated floor of the mouth and the lingual gingival tissue. It is 1/2 pear-shaped with the bulkiest portion inferiorly located. The superior border is tapered. It should be located at least 4 mm inferior to gingival margins and more if possible. The inferior border is located at the height of the floor of the mouth, when the patient's tongue is slightly elevated. A long bar requires more bulk than a short bar, however, the cross-sectional shape remains the same. Mandibular lingual plate is used when less than 8 mm of space exists between the free gingival margin and the elevated floor of the mouth. It is used when extra bracing is required, when the residual ridges in a Class 1 arch have undergone such vertical resorption that they will offer only minimal resistance to horizontal rotations of the denture. It is used to support periodontally weakened teeth and group function. Also, when the future replacement of one or more incisor teeth may be anticipated. The mandibular lingual plate is 1/2 pear-shaped with the bulkiest portion inferiorly located. A thin metal apron extends superiorly, to contact the lingual surface of anterior teeth and involved posterior teeth at their height of contour. The apron is extended to the height of interproximal contact points, that is, closing interproximal spaces. The apron is scalloped. The superior border is finished to a continuous plane with contacted teeth. The inferior border is at the height of the floor of the mouth, when the patient's tongue is slightly elevated.
A palatal plate major connector is used in a Class 1 partially edentulous arch having residual ridges which have undergone little vertical resorption. It is also used in V or U-shaped palates, and in cases with strong abutments, single or made so by splitting. It is used when there are more than 6 remaining anterior teeth, and when the direct retainers do not offer a problem, and there is no interfering torus. It is of anatomic replica form. The anterior border follows valleys of rigae and crosses the arch at a right angle to the midline. It does not extend anterior to the fulcrum and/or the indirect retainer. The posterior border is located at or anterior to the vibrating line. It does not extend onto the soft palate. It is extended to the hamular notches in the extension base partial. Finishing lines are no farther medially than 2 mm to an imaginary line which would contact the lingual surface of the missing natural teeth. Complete palatal coverage is occasionally required. In most situations, such as in the Kennedy Class II arch, with a posterior modification space, and some missing anterior teeth on the distal extension side. A Class I arch with 1 to 4 premolars and 1 to 6 anterior teeth remaining, where abutment support is poor and cannot otherwise be enhanced. Also, where residual ridges have undergone extreme vertical resorption and where direct retention is difficult to obtain. The complete palatal coverage major connector has an anatomic replica form for full palatal metal casting supported in the anterior birest seats. It is designed for the attachment of acrylic resin extension bases. It contacts all, or almost all, the teeth remaining in the arch. The posterior border terminates at, or anterior to, the vibrating line, and extends to the hamular notch area, on the distal extension side. It crosses the palate, at right angles to the midline.
The anterior-posterior palatal strap is used with Class I and II arches, in which excellent abutment and residual ridge support exists, and direct retention is adequate without the need for indirect retention. In a long edentral span Class III, modification 1 arch. In Class IV arches. And when there is an inoperable palatal torus, which does not extend to the vibrating line. The anterior-posterior palatal strap is parallelogram-shaped and open in the center portion. It has relatively narrow 8 to 10 mm anterior and posterior palatal straps. The lateral palatal straps are 7 to 9 mm wide and parallel to the curve of the arch, a minimum of 6 mm away from gingival crevices of remaining teeth. The anterior palatal strap anterior border is not placed farther anteriorly than anterior rests and never closer than 6 mm to lingual gingival crevices. It follows the valleys of the rugae at right angles to the median palatal suture. The posterior border of the posterior palatal strap is located at, or anterior to, the vibrating line and crosses at right angles to the midline. It extends to the hamular notch area on the distal extension side. It has an anatomic replica or matte surface.
The U-shaped palatal major connector. This connector should be used only in those situations where inoperable tori extend to the posterior limit of the hard palate. Severe gaggers may also be considered, as well as certain Class IV designs. The U-shaped palatal major connector is probably the poorest design of all palatal major connectors, because it lacks the rigidity of other types of connectors. Where it must be used, any portion of the connector extending interior to the fulcrum line must be supported by indirect retainers. Border areas of the connector must be kept at least 6 mm away from adjacent teeth. If for any reason the anterior border must contact remaining teeth, the connector must again be supported by rests placed in properly prepared rest seats. It should never be supported, even temporarily, by inclined lingual surfaces of anterior teeth.
Minor connectors. The minor connector joins the major connector with other parts of the denture. These components also serve to transfer functional stress to the abutment teeth and to transfer the effect of other stresses to other parts of the denture. Thus forces applied to one part of the denture are resisted by another.
Form and location of minor connectors. Like the major connector, the minor connector must have sufficient bulk to be rigid, otherwise, the transfer of the stresses and of the function of other components cannot be effective. At the same time, the bulk of the minor connector must be as unobjectionable as possible. A minor connector contacting the axial surface of an abutment should not be located on a convex surface but, instead, should be located in an embrasure, in which it will be the least noticeable to the tongue. It should conform to the interdental embrasure, passing vertically from the major connector to the other components. It should be thickest toward the lingual surface, tapering toward the contact area. Generally, the minor connector should form a right angle with the major connector, so that the gingival crossing may be abrupt and cover as little of the gingival tissues as possible. When a minor connector contacts tooth surfaces on either side of the embrasure in which it lies, it should be tapered to the teeth so that the tongue may encounter a smooth surface. Sharp angles should be avoided, and spaces should not exist for the trapping of food debris.
When an artificial tooth will be placed against a proximal minor connector, the greatest bulk of the connector should be located toward the lingual aspect of the abutment tooth. In this manner, sufficient bulk is assured with the least interference to the placement of the denture tooth. Ideally, the artificial tooth should contact the abutment tooth with only a thin layer of metal intervening buccally. Lingually, the bulk of the minor connector should lie in the interdental embrasure the same as between two natural teeth. Denture base retainers are minor connectors. This minor connector should be so constructed that it will be completely embedded within the denture base. The junctions of these mandibular minor connectors with the major connectors should be a strong joint but without appreciable bulk. Angles formed at the junction of the connectors should not be greater than 90 degrees. An open latticework or ladder type of construction is preferable in the extension base partial denture. The minor connector for the lower distal extension base should extend posteriorly about 2/3 the length of the edentulous ridge, and have elements on both the lingual and buccal surfaces. Not only will such an arrangement add strength to the denture base, but in all probability it will also minimize distortion of the cured base from its inherent strains due to processing. The minor connector must be planned with care, so that it will not interfere with the arrangement of artificial teeth. Minor connectors for maxillary distal extension denture bases should extend the entire length of the residual ridge, and should be of a ladder-like construction. The finishing line junction with a major connector should take the form of an angle of less than 90 degrees, therefore being somewhat undercut. Of course, the medial extent of the minor connector depends on the lateral extent of the major palatal connector. Too little attention is given this finishing line location in many instances. If the finishing line is located too far medially, the natural contour of the palate will be altered by the thickness of resin supporting the artificial teeth. If, on the other hand, the finishing line is located too far buccal, it will be most difficult to create a natural contour of the acrylic resin on the lingual of the artificial teeth. The location of the finishing line at the junction of the major and minor connector should be based on restoring the natural palatal shape.